I'm going to turn over to Dr. Reichman now. You talked a lot about the goals of using radiation for patients with stage 4 lung cancer, hopefully helping them feel better, maybe giving them more time on the treatment that they're on. One of the questions I want to ask you about is, let's say a patient got radiation and maybe a few months down the road, there's a spot that pops up again nearby, or it involves that site again. Can we use radiation again? Talk a little bit about re-irradiation.
Yeah, so gosh, re-irradiation is such a difficult concept and situation. We're really making strides in terms of prioritizing safety here, and it's a highly complex decision-making process. Actually worked with Joe Chang from MD Anderson on a website called cancerretreatment.org, because everyone deserves a second chance. It's free to use for radiation oncologists, and it helps us navigate through these decisions. But in reality, there's a lot of hand waving involved in these situations. And for me, the most difficult thing is how to counsel the patient in the face of uncertainty. Sure, by the books, I could come up with a plan anywhere in the body, to feel okay and really treat myself to feel more comfortable. But I tend to over counsel patients on the risks in these scenarios. Often it can be quite safe, but it really depends. It's hard for me to discuss specific scenarios because it's so complex. But there's been plenty of times where I've done radiosurgery in the lung, or SBRT or SABR would be the appropriate term there. And then there's been a spot that's popped up a centimeter or two away. And as long as that's like in the middle of the lung, folks tend to tolerate that pretty well. But the difficult scenario, where and they don't even realize that they're getting a second course often with stereotactic radiation in the same area or SBRT. But when things become like close to the chest wall, there could be a higher degree of chest pain. Often we can do temporary rib blocks with alcohol, and sometimes permanent rib blocks to help with that chest pain. But then the central areas around the windpipe, in the heart, it becomes more complicated. And so it really is driven by where is the spot and what's the scenario? What dose are we giving? Is it a higher dose or a lower dose? How is that patient doing? Are they going to want to do a more aggressive treatment or a less aggressive treatment? So the short answer is I struggle with that on a case by case basis, and it really depends on the patient.
And is there a hard cutoff in terms of timing from the last time they received radiation?
These are really good questions. Yeah, generally speaking, we feel better when it's been 6 months. I mean, I like 2 years. But we can justify treating within 6 months if it's out of field. If it's in field less than 6 months, then I think it's kind of silly. The definition of insanity is doing the same thing and expecting different results.
Mm.
But, with a good dose, the first time around, 95% of the time, you're not dealing with recurrences, right? But if it was a gentle dose to begin with, then it might make sense to treat within the 6 month window.
Yeah.
So it's complicated. Yeah.
No, thanks for sharing that. It's very nuanced.